Now, there's another classification of nephrotic syndrome, and this classification is based on, okay, somebody has nephrotic syndrome. If I treat this person, will the disease go and come back? So we call that, if the disease that will go and come back is what? Relapsing, frequently relapsing. So what is this type of nephrotic syndrome? And possibly we'll talk about how to handle it. Okay, so this is nephrotic syndrome where there's a lot of damage to your glomeruli. So instead of proteins coming here and not being filtered out in urine, proteins are being filtered because the glomeruli is damaged. There's no checks and balance anymore. So frequently relapsing type, it just refers to a clinical cause where a patient experiences multiple relapses of nephrotic syndrome after they were treated. So they were treated so many times, but the disease keeps coming back. You know. So relapse is reappearance of proteinuria after it has remitted. Relapse, it has gone away, still came back. So frequently relapsing is typically defined as 2 or more relapses within 6 months or 4 or more relapses within 12 months. That being treated is coming back. So we also have steroid dependence. So some patients relapse as soon as steroids are tapered or stopped. They use steroids to kind of like treat the condition. So to reduce the inflammation and damage to the glomeruli. So sometimes you feel like the patient is getting better. So once you stop the drug, it comes back. You understand? So this is just an overview of nephrotic syndrome. So why it happens? There's an underlying pathology. So things like minimal change disease is highly steroid responsive. But once you stop giving them the steroid drug, the disease condition comes back to normal. Immune dysregulation, maybe the person have other infections, the person is stressed, or is having other things that are disrupting the immune system. So steroid tapering, so rapid withdrawal of steroids increases relapse risks. So sometimes even if you stop giving them steroids, be doing it small, small, small. Be reducing the dose small, small. Don't just stop all of a sudden. Then also the genetic and immunologic factors play a role. So clinical consequences, the person is having repeated episodes of what? Nephrotic syndrome. So proteinuria, edema, hypoalbuminemia repeated. Steroid toxicity, so you have used steroid for too long, can cause growth retardation, obesity, hypertension, or osteoporosis, hirsutism. And also psychological burden, so frequent relapses will disrupt your schooling, your work, your quality of life. So steroid sparing agents, cyclophosphamide, cyclosporine, rituximab, tacrolimus may be used to now reduce the dependence on steroids. And diuretics, angiotensin converting enzymes, angiotensin receptor blockers. Okay. So preventive measures is, if the person is having infections, tackle those infections. And if you want to stop giving them steroids, you have to do it small, small. Okay. Not too much. Okay. So that's what we have for this type of nephrotic syndrome.